Hello, I'm Gary Nollet with Compass Insurance Group, and we're here to give you an update on the changes that are coming to the Medicare Part D plan in 2025. Just as a quick recap, we discussed this in an earlier episode, but effective in 2025, Medicare has decided to eliminate the coverage gap, or what we commonly call the donut hole. And that was that point in time where if you were taking expensive medications and you reach a certain threshold, your drugs would go from a low cost to a very high cost. They would actually go up to a 25% coinsurance, and that was 25% of the retail price of the drug. So if you had a $600 drug that you're paying $40 for, when you hit this threshold, it would jump all the way up to, what is that, $125. So, or $150, I guess it would be. Well, that's being eliminated next year. That's good news. They will cap your overall out-of-pocket expense for the year between your co-pays and deductibles and coinsurance at $2,000. And actually, and I won't go into a lot of detail about this, but you also will get credit for money spent on your behalf through drug company discounts. A little hard to explain, but for example, when you're filling drugs, maybe for each drug that you fill, it's a $400 drug and they're really dropping it down in a negotiated discount of $100. Well, that $100 is spent on your behalf, not it's coming out of your pocket, but just spent on your behalf, counts towards your out of pocket. So a person may end up spending $1,500 out of pocket or even much less than that, but you get credit for the full $2,000 of expense. So that is good information, good to know. The bad part about all that, originally, Medicare did not provide any funding for these changes. So they were taking all those extra payments that you as a Medicare Part D beneficiary were paying out of pocket, and we're pushing it back on the insurance company to just make up all that and to absorb all that. Well, they're just not going to be able to do that. It's millions, maybe even billions of dollars. So they're going to be forced to push your premiums way up higher and add a lot of things. Well, lo and behold, in the last week or two, Medicare decided that was a bad idea. Maybe because it's election year, I don't know, but it was a bad idea to begin with. And the predictions were $150 to $200 a month in premiums. When they saw that, they decided we better fund this. So they created what's called a demonstration program, which means it's not permanent at this point. But if a company chooses to participate, then they will fund them to a level that will allow them to raise the premiums on a Part D prescription plan. So I'm talking about standalone prescription plans right now that you would have, not inside of an Advantage plan, but they will limit that to no more than the $35 increase. So if you were paying $30 for that plan right now, it could potentially go up to no more than $65 if that's the same plan. So there are some limitations in there. The good news is that was going to be over $100. Now it's going to be limited. We're still waiting to see firm details. This is the information they're giving us right now. So things aren't quite as scary as originally because they came through at the last minute and provided some funding. And presumably all the companies chose to do this because if they didn't do it, they probably wouldn't be able to sell their product and they wouldn't be able to participate in this in a later time as well. So hopefully they've all participated in that. What is still going to change though is this didn't make up all the deficit that these companies are expecting to have. So you will probably see more plans with deductibles than you saw in the past, and maybe some changes in formularies. We haven't seen much from the companies yet. They've been keeping it close to the vest. One company we saw, we can't talk about names yet, but this particular company, the very, very large company, they will be limiting to the 35, of course, on that. But their formulary, they say at this point, has not changed. So that means expensive drugs aren't necessarily either taken out of the list of covered drugs or they're not necessarily moved up. Again, that's not to be seen, still is to be seen yet how that's going to turn out. But we wanted to keep you updated that you are going to see some changes in your drug coverage. Now, for those of you in Advantage plans, we mentioned before that because they have more things built into their plan, a lot of the extras especially, like your dental, your vision, your gym memberships, the over-the-counter benefits, I'm expecting to see, and have already seen a little bit of this, a little bit of cutback in those areas. So some of the companies are being smart and going to keep the medical benefits, which frankly, folks, that's what you need to focus on anyway, is the core medical benefits. You're buying medical insurance. You're not buying a $40, a $50, a quarter gift card. If you get that over-the-counter card, if you get that, that's great. But you want to have good coverage that's going to limit your out-of-pocket expense should you have a major event occur. So if they happen to cut back your dental a little bit or a little bit on an over-the-counter benefit, I wouldn't worry about that too much. And yes, you can shop around for other ones, but they're all going to have to make some kind of changes to make up for this squeeze that's put on them by Medicare. And if they take away those little bit of extras, that's better than destroying the medical part of your plan or really turning upside down your prescription coverage. So be on the lookout. Starting next week, most companies are mailing out their ANOC, that's the annual notice of change, that describes the changes taken into your that are going to be taking place on your plans for the upcoming year. As soon as we get a hold of one, we're going to do another video to show you how to read those. Doesn't matter what company you're with, the format is exactly the same. So we can, whatever one we get a hold of, we'll use to show you, but it'll apply to whether you've got United, WellCare, Humana, it won't matter. We'll be able to give you a little bit of education on that. So stay tuned, make sure you follow us, you like us, share this, tell your friends so we can get everybody educated. Thank you.